Millions of people have signed up for insurance under the Affordable Care Act and now may see a doctor for the first time in years. New York One's Rocco Bertuccio joins us now with some tips on how to choose the best doctor for you.
There's so much information out there. It can be confusing, a little bit daunting, trying to pick the best doctor for you and your family. Dr. Matthew Weissman, the Chief Medical Officer over at the Community Healthcare Network, joining us now in studio with more on how to go about this process. Thanks for being here. Appreciate it.
Thanks for having me.
Those who don't know about your organization, Community Healthcare Network, a not-for-profit providing access to quality, affordable health care in all, not just Queens, many parts of the city. You guys do great work.
Thanks. We have 11 sites across 4 boroughs. We do primary care and GYN care for about close to 80,000 patients a year.
Yeah, so now with the new healthcare law, more and more New Yorkers have healthcare insurance, so now this new frontier for you folks is helping them choose the right doctor now that they have insurance. You have an upcoming workshop next week that will help them through this process. Before we go into specific tips on how to choose a doctor, describe this workshop, who is welcome to join, and how it's all going to work.
So I'll be speaking at the Harvest Room in Jamaica next Wednesday morning, and it's going to be a great event. We've spent a lot of time. We have 6 federally funded healthcare outreach workers who've been spending the last couple of months signing people up for the healthcare exchange and also educating people about healthcare insurance in general. And so now, as people are getting signed up, and we've signed up hundreds of people, we've done outreach to thousands, now's the time, now that people have insurance, to try to figure out how to get them connected to care.
All right, we have some specific tips. So let's go down the line. The first one, find a doctor who is board certified. So how do you do that? Board certified at the county level, the state level, both?
So for board certification is a specific test or a specific set of requirements that doctors have to go through, and that's sort of the bare minimum from my point of view in terms of making sure that somebody is qualified and up to date in their knowledge. There are lots of websites that can help you with that. The state runs the New York Doctor Profile, the American Board of Medical Specialties details that information, lots of ways to find that online.
Okay. Also, you say check for other credentials, referring to training and experience. What should you look for?
So I think it's always interesting to know where somebody went to medical school and residency, if they did a fellowship or have other certifications. But it's also nice to know what the office has. So for example, at CHN, we're accredited by the Joint Commission. We're recognized as a patient-centered medical home level 3. And there are lots of external agencies like that that come in and audit practices to make sure that their practice is really up to the best level of performance.
You also want to make sure that the doctor is reachable by phone, online, after hours. I mean, how reachable should a doctor be after hours?
So, I mean, you want a doctor's office that can work with you. And that's actually one of the patient-centered medical home standards, is that when you call at night, you don't get a recording that says go to the emergency room, but you're actually put in touch with a doctor or a nurse, somebody or some sort of service that can triage your call, figure out how urgent this is, whether it's something that can wait till the morning or whether you need clinical advice right away, and then find a way to get that to you.
You also say find a well-run, organized office or a healthcare center. So what should you look for when it comes to the office itself and the healthcare center?
I mean, so you want a doctor that you can talk to. You also want staff that you can talk to and that help coordinate things. We're very fortunate that we have a referrals department that helps connect people to subspecialists if they need subspecialty care. We have a health literacy department that keeps people educated in a patient-friendly, easy-to-access way if they have questions or they're confused about some of the things that their doctors have said. We have other support staff, health educators, nutritionists, social workers that can work with patients. So you really want a kind of cohesive team like that.
Any red flags you should look for that should kind of deter you if you see something that that may not be?
I mean, I think anytime you feel like somebody's blowing you off or not taking you seriously or doesn't want to answer your questions or doesn't want to answer them in a way that you can understand, that should be concerning.
All right, also figure out what you want from a doctor. So obviously this will vary from household to household. So what should you ask yourself when you're choosing a doctor?
I mean, I think it's good to set up a time with your doctor when you're healthy, when you're feeling relatively good, and sort of talk to them about their philosophy. You know, are they someone who sends people to a lot of specialists or tries to handle things themselves? Do they want antibiotics for everything or medicine for everything, or do they want to try some other remedies? And then you want to sort of see how that philosophy fits with your philosophy about your own health. healthcare.
And the last one on the list, and I imagine pretty important, make sure you're comfortable with your doctor. That's got to be an important one.
Right. I mean, you want them to have a good bedside manner. You also want the office to have good credentials and all those other things. But you want to feel like you can talk to them and that they'll explain things in a way that you can understand.
So there are some real challenges there because now with so many people who have healthcare now, which is a good thing, but they've never had a doctor before. So this will really be a new experience for a lot of people in Queens.
Yeah, I mean, I think, you know, people have had to learn a whole new language of insurance and copays and deductibles and all those things, and now they have to really use that knowledge and figure out how to apply that to the doctor's office, how to learn a whole new language about interfacing with doctors.
And finally, real quickly, where do we stand now with getting people registered for their health care? It was a rocky start nationally. New York, much better off, so we're still doing pretty well compared to the rest of the country? Or?
New York's been doing really, really well, and that's good, and we've proud to say we've been a big part of that, doing outreach out in the communities. And we're continuing to sign people up. March 31st is the next deadline, so there's still opportunity for people who haven't signed up to sign up, and we will have some outreach workers at this event next Wednesday. And so we hope we'll be able to continue to sign people up over the next 6 weeks.
All right. Appreciate your time, Dr. Matthew Weissman. Appreciate it.
Thanks.
Keep up the great work. And here's another plug for that workshop, as the doctor mentioned, next week in Jamaica on Wednesday, February the 12th from 10 to noon over at the Harvest Room. That's over on 160th Street in Jamaica. There's a phone number you can call for more information, 212-545-2437. Okay, stay with us, everyone. When we come back, we'll introduce you to our Queens people.